Assalamu alaikum. The communication day. We will start with this case scenario. Patient came with attacks of seizure, and the CT are remarkable. He has been celebrated with his friend's birthday, and he had the seizure today. Presented to the emergency. All the workup was negative. So you will sit with his brother, and the patient asks you not to mention anything about the part drug he received yesterday. So the task is to sit with the brother to talk about the patient condition. So the patient name is Adam, Mr. Adam. He's 35 years, and his brother, let's say, Mr. Ali. Okay, we'll start after sharing the timer. Okay, let's start. Ready? Hello there. I'm
Yes,
Dr. Mukhtar, the doctor,
hello.
and I'm Dr. Mukhtar, the doctor in the emergency. You must be Mr. Ali.
Yes, hello, Dr. Mukhtar. Nice to meet you.
Yeah, you are the brother for Mr. Adam,
Yes, I am.
and he is 30 years.
Yes.
Yeah, the nurse told me that you requested to meet me and to talk about Mr. Adam condition.
Yes, true.
Yeah, uh, yeah, I got permission from Mr. Adam to talk about his condition with you.
Yes, sure,
Okay,
doctor.
before we go further, what do you know so far about Mr. Adam condition?
Actually, doctor, I know that this is quite weird that he has this seizure, and it's really coming from out of nowhere. Like we are quite like it's weird. But he looks fine. He's fat, just like I don't know where that could be coming from. That's what my concern now. That's what I know.
Yeah, I appreciate your knowledge about your brother, Mr. Adam condition. And can I ask you what's, in your opinion, ongoing?
I don't know. I don't have any idea. Uh, I'm not sure. That's why I need to know more.
Yeah, I appreciate your knowledge and you worry about your brother. So let me tell you in brief that we received Mr. Adam in the emergency and we did all the tests and scans for his brain, and we can assure you that everything came as normal.
Okay,
You are with me?
that's good then, right?
Yeah, this is the good news. Yes. Actually, what I can tell to you that this seizure, or what we call abnormal movement in his shaking in his body, happened as once. Uh, However, we did everything to be sure that no other cause in his body led to this shaking. Are you following me?
Yes, yes, I'm with you, doctor.
Yeah. So we can, after we sit with Mr. Adam and we tell him about everything and all this finding, and we explained to him and educated him how he can deal with his life in the future, and everything will be okay. So this is the time we can send him home, and we can assure you that he will be fine in the coming days. Let me give you some instruction about his condition in the future. Please, if you notice that
Hmm.
he has any shaking in the body, uprolling of his eyes, or any abnormal feeling, abnormal vision, please bring him immediately to our emergency department. You
That
are with
looks
me.
fine. Yes, but
Yeah,
doctor,
you have in
what
yeah, you have
what
tell
about
me.
what like what I sh so what does this mean? Like this seizure is could it this be just could he I heard that this could be due to the party. Did they disclose anything? Did they say this is related to his seizure?
I appreciate your worry and your concern, Mr. Ali. However, these finding or these issues will be privately only given to Mr. Adam. What I can tell you now that everything in his blood tests and all his workup and all his scans came as normal. So this is reassuring things. And as I give to you the instruction about the future, just to be careful with him in the coming days. If you need any help, just be aware and be beside him. And please don't leave him alone
Mm,
in any closed
mm,
area. Don't let him swim in a pool alone.
mm,
And also, you can tell him not to close his door after him in the bathroom.
mm.
Did you
Okay,
understand that?
that's great. Okay.
Yeah. You have any other concern?
Um, no, but what if this comes again?
Yes, as I mentioned earlier, I will give you also the contact number of our hospital, and immediately you can call the ambulance. Plus, if you don't have the time to bring the ambulance, you can. I will give you some instruction, and the nurses can educate you how to manage this shaking in the body and how to put him in a proper position before bringing him to our hospital.
Mm, okay,
Yeah,
sounds good.
you get that.
Thank you.
Yes. Okay. You have any other concern?
Well, what does this mean? What is the reason? Did you find any like what is the cause could be yet?
Uh, uh, I appreciate your concern. The medical point of view showed that nothing in his brain showed it might be the reason for his activity or for his shaking. We did the scan, and I can reassure you that nothing in his brain can cause the attacks of shaking. Did you get that?
Mm, yeah,
Yeah. Can I ask you some question?
sure.
Does Mr. Adams smoke?
No,
Has he
he
ever
doesn't.
smoked?
No,
Okay. Does he drink alcohol?
he is fine. He doesn't. He sometimes goes to the weekends on the alcohol just below the limit, and he's actually quite fit man, and he does regularly exercise.
Yeah, we can advise regarding his alcohol to be in the social limit, not to exceed 14
Yeah,
units per week. Yeah, in order
yeah,
to prevent also because the alcohol can lead to these shakings. Okay,
sure. Thank you,
okay.
doctor.
Apart from that, what's his job?
He's still in the college, and he's doing fine.
Okay, does he need any support?
No, he's totally great.
Okay, does he drive?
Yes.
Okay, so to be safe, you can take him home today. But in case of he has any further seizure, I'm afraid to say he will be not able to drive until we
Mm,
find the reason behind that. Okay.
okay, I can
But
help him with
meanwhile,
driving.
yeah,
Yeah,
meanwhile you can pick him up to the home today. Not don't
yeah,
let him drive today, and
yeah.
in the future we will observe that shakings.
Mm,
Okay.
okay, okay.
He has any hobbies?
Um, Nothing in particular. He goes to golf. He sometimes goes to the gym and swims, but as you said, we will follow your instructions keenly.
Yeah. Yes. This is good advice, and good to know that you already understood that. If he want to do
Yes.
any hobbies, he can do, but you can be with him, accompanying him, and just observe him
Mm,
in the future, in the coming couple of weeks.
mm, mm.
That okay?
Okay.
You have any other
Fair
concern?
enough. Oh, no, thank you. I think that's okay.
Yeah, I can hand you the instruction about the future days, how to deal with the seizure and shaking it if it happens. And I will give you the contact number of our hospital for any inquiry
Mm,
or if you need any help. That okay?
yes. Okay.
Okay. Nice to meet you, Mr. Ali. Thank you for letting me sit in with you today.
Thank you.
Okay, Dr. Abdullah, time is up.
Okay.
Yes, you can comment first.
Uh, okay. So there is. So you spoke about. So this scenario is actually about the confidentiality, and also there is the medical judgment in regards to that this is a first stager that is provoked, but it could happen repeatedly in case if it is epilepsy. The diagnosis is not certain yet, so he will need a neurology assessment. That's hidden agenda, just to tell the brother that this is could be part of the plan. Uh, you touched the risk fact, the triggers, the in lifestyle change modifications, the safety netting, and the driving essential. There is very important point in possibility to prepare the family for possibility of if this seizure happens again, then there's another plans. So he may be added anti-epileptic medications. Yeah, and that is all.
Yeah, thank you. Yes, I supposed to mention the neurology team or the nerve doctor. He will follow him in the future, and he might be prescribed on anti-epileptic in case it's
If such an thing.
repeated
Yeah.
again. Yes, you're right. Yes, thank you, Dr. Medication history and family history. Dr. Islam asked, medication history and family history are missed. No, this is a
No,
communication
it's not
scenario.
his.
Yeah,
Yeah.
it's not allowed to take any history. I can't ask about any history, either family or education or medical or whatsoever. Okay. Any question from others? Any comment? Yeah, thank you, Dr. Islam. Any other question? Any comment? So this
Hi,
scenario,
Sebastian.
con yes,
Yeah, I would like to add something, or maybe I came late, so I just want to ask you
yeah,
because Dr. Abdullah did not insisted on knowing the reason, like a brother. I was thinking maybe he's going
uh-huh,
to insist you a lot that maybe that he heard that he took something in the party, or maybe he went his
yeah,
15s, and I'm sure that he was taking something. I was thinking that he will, give you a tough time by asking again the same question, but it was a very smooth scenario, so I'm not sure Dr. Abdullah would have pushed you through it by asking again about the same question, that why did he have a seizure. And secondly,
hmm
did you ask him that are you aware of his condition? Did you tell him that did the brother know that he had a seizure or not? Because you
yeah,
asked
yeah.
him and explained him, so that means the brother did not know that he was brought to the emergency because of the seizure.
No, no, he knows. I asked him this question in the introduction, and he told me yes, he had a seizure. Yeah, this is for the first question. The second question, if he insists even till the end of the scenario, if he insists and I will one time mention to him yes or any possibility, the case or the scenario will be or the station will be failed. So whatever he will do, and he insists for that, even he give you background that he knows, I will just say it's his confidentiality. I cannot breach it's his confidentiality. You get it, Dr. Rabia?
Okay, and you should have told him about the sleep also. And he might have asked you
Yeah,
for how long
yeah,
I should stop swimming, I should stop driving.
yeah.
So you can answer him that
Excellent,
I'm not sure about this. We can refer you to the nerve doctor and he will
excellent.
assess you and let you know for how many days or how many weeks and months you should stop driving and swimming and whatever.
Yeah, yeah. Sleep also, sleeplessness, one of the trigger for seizures. So I should give him some advice about sleep. Yes, you're right.
Mm, yeah.
Okay, the driving, if provoked like such scenario, it will be just as warning for him. But if recurrent unprovoked seizure, that time only he should inform DVLA. You got it, Dr. Rabia?
Yes, okay.
But meanwhile, due to the seizure due to the recreational drug exposure, so it's a provoked one, and I can just tell him not to drive temporarily, but uh, if the seizure recur back, that time only he should inform Devil A and he will follow the Devil A rules.
Yes, it's like unprovoked first seizure, 6 months. Unprovoked recurrent
Yes,
seizures, 1 year.
yeah, okay. Thank you, Dr. Rabia. Any other question? Any concern? Any comment? Okay, Dr. Abdullah, prepare yourself for the second scenario.
Yes. Mm.
Yes, this is new style
Um,
scenario. I will write in the chat.
mm.
Still communication.
उधर हो उधर इतनी जगह किसके लिए छोड़ी हुई
Okay, you can read the scenario, Dr. Abdullah.
नहीं
Yes.
उतनी उधर नहीं है
Mr. Robert, 71 years old, in the stage renal disease on hemodialysis, come with knee pain, diagnosed gouty arthritis, given intraarticular steroid injection as gouty arthritis. Later results of the aspirate came with 100,000 white blood cell patients still in pain. Task explained to the doctor about need for admission and IV antibiotics. Mm,
Miss
me-
Lisa.
me-
Mrs. Lisa,
Miss
sorry, Mrs.
Lisa
Lisa.
inside, she's angry about wrong diagnosis initially. Want to complain, and why, given a steroid injection, it will increase infection for him.
Okay, take a
Okay.
minute, then we'll start. Ready?
Yes, Dr. Bassem, let's start.
Yes, here you go.
Hello,
Hello.
my name is Dr. Abdullah Al-Malla. I am one of the medical doctors here. Am I speaking with Mrs. Lisa, the daughter of Mr. Robert?
Yes, doctor, I am the one.
Nice to meet you, Mrs. Lisa.
Thank
I'm sorry for. I'm sorry. I heard that you were quite angry.
Yes, doctor, because
Yeah.
what happened for my father, doctor?
Could you tell me, yes, how can I help you today?
Yes, doctor, please let me know why you inject the steroid inside the knee of my father.
Mm, this is a good question. And can you tell me what do you know about his condition
Yeah, I know a
first?
lot, doctor. I am the one taking care of him. I am the one next of
Mm,
kin for him.
yeah.
I know that my father already on dialysis. His kidney failed since long time, and I know
Mm,
there is some complication because of this failure of the kidney. One of them, yeah, I read about it, which is called gout.
mm,
Since my father had this pain in his knees, I guess that it might be
yeah.
related to the gout. So I brought him immediately to the emergency, and
Mm,
your doctors did the blood test and they took
mm,
snip from his knees.
mm,
Then they give him steroid inside the knees.
mm. So let me uh, tell you that this is I'm quite um, sorry for what you have saw and what your father has received. If that something would lead him to a worse state in non-purposeful way. The doctors gave the injection of steroids, and that was meant to treat the supposed gouty diagnosis. Um, but let me say that sometimes in medical practice initially and a lot of situations that the conditions are not quite clear from the first moment. I'm not defending my colleagues, but in some case, as I told you, this injection first is not supposed to be given in the first time, and but the situations sometimes are quite vague. Um, Let me tell you also, and I'm really sorry for that injection again. Uh, if something happened, you want to correct it, you want um, to if what you want is you're angry, you're supposed to be angry about that. If I was in your place, I would be also, I would not like something to be put which may worsen my father condition too. Could you tell me how can I help you with that?
Yeah, doctor, they called me again and they said it's not gout, it's something else, which is infection inside his knees. So I can guess that
Hmm.
the injection you put, the steroid, I mean, is the cause behind this infection.
It's a good question, but let me tell you that uh, it's also, as I said, the in medical practice, sometimes you cannot be sure if something is the diagnosis. It's the medical diagnosis here was the assessment. Actually, it was gout arthritis. That's the medical judgment by the whole team, and finding steroids in that collection that they took from the joint does not, finding a lot of cells does not mean that this is a reason of that this is infection happening. It sometimes the sometimes the injections will lead to findings which could be affected by the injection at times. But I hope you are clear with me at the moment. Until now.
Yes, I can understand everything.
Yeah. So,
but I
just
want to know
yeah.
clearly, is it gout or infection, doctor? What do you think?
Okay, let me tell you that when we found the cells, the diagnosis has changed. That so when we get, usually sometimes we get two diagnoses, two conditions in one thing. The gout could happen when on top of it there is infection. In these cases, there is quite necessity to give antibiotics, which are anti-bug treatment to clear up inside the infection. And this will require admission in Mr. Robert's case to the
Okay,
hospital.
doctor. Okay, doctor. So what I
Are you okay with
understand
that?
now. Yes, sure. What I need only my father healed to be fine. Be sure I am so worried about my father condition. Yes, if he need admission, please admit him and do everything. Okay,
Sure.
doctor?
What so what do you what we have explained so far? What do you get from what we explained so far?
Yeah,
If you want me to recap for you.
No, doctor, I understood now that you suspected the gout initially. However, when the result of the cells came as high, you re-diagnosed the condition as infection. Is it?
Yes, so there could be, as I told you, so there's gout, which is very common, as happens in kidney disease, and as you are appreciated for your knowledge. But this infection make it complicated, and the management will be changing. That the requirement of antibiotic is very essential and crucial to prevent spread to other organs inside, critical organs in the body, like the heart, kidneys, lungs. And for that, we need to prevent that by giving IV antibiotics, admission. And
Okay,
I will also go straight to help you if you want to see any improvement in practice and to improve on the standards of the hospital. If you think this injection is quite made his condition worse, you can actually raise the complaint, and I may guide you for that.
no, doctor, no, I have no doubt about admission. Okay, go ahead, doctor, with admission. Thank you.
Do you have any questions at the moment?
No, no, no. Thank you, doctor.
Did Mr. Robert has any wishes done in case his condition deteriorates further before?
No, 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 doctor, no. He's fine.
Okay. Well, thank you for coming here.
Okay. Okay, time is up. Yeah, I think a stressful case.
It's
Yeah, I can feel your stress, Dr. Abdullah, but you did it great. Actually, you did it in the perfect way. It's uncertainty, right? So it's
mm,
like in the gray zone between the gout and the septic arthritis, and between the medical error and still uncertainty of the diagnosis. So if I am in your place, I will not deal with the case as medical error,
mm.
because the patient just admitted and the result maybe take time to appear, and this only in this episode of admission. So the decision was in the best interest for his condition. We suspected the gouty arthritis based on the blood test and his clinical condition. However, the aspirate result came and it showed that there is leukocytes or cell count more than 100,000, which is going with septic arthritis. So in this time, we have to change the diagnosis and to start the antibiotic, IV antibiotics. And for the steroid, even it was given earlier, but still it's not uh, because no time before diagnosing the patient, only short time between giving the steroid and the lab result or the aspirate result. Okay, let's guess
You
the
mean the
scenario.
injection can affect the
Yeah,
result falsely too?
no, 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 no. I mean that the injection was not the reason of the steroid injection is
Oh,
not
yeah,
the
yeah,
reason to be
yeah,
septic
yeah,
arthritis.
yeah, yeah.
So he came
Mm,
with
mm,
septic
mm,
arthritis, but the result only diagnosed that. But the clinical
mm.
finding was going with gouty arthritis, and it was managed as the best of interest for his condition. Okay, let's imagine the scenario will be in a different way. Patient came admitted as uh, knee pain, okay, and the aspirate done from the first moment, and it showed the result of 100,000 as in this scenario, but the result wasn't seen by the team, and they give him the steroid injection intraarticularly. Then later
Oh,
on,
here
the
it
result,
will, yeah.
yeah, yes,
Here I will
exactly. It
deal
will
it with
be,
there is an error.
yeah, exactly. Since the result here is not appeared and we are not aware about, and we suspect gout arthritis and we inject the steroid intraarticularly in the best interest for his condition, so I can make like uncertainty diagnosis and we can manage as gouty arthritis and no medical error. If the result take long, for example, and appeared and no one called for the result in the system, and no one have seen the result, and the team was given the steroid injection, and the condition now worsening because of the steroid, this time will be as medical error, and I will apologize for this mistake. You got it.
Yeah, yeah.
So the duration and the circumstances of the scenario will guide you either medical error or uncertainty for diagnosis. So let's go back to our scenario after the introduction and asking for the case, why you are angry, what do you feel, like that, as introduction question. What do you think? What do you know about your father condition? The duration, if she give you short duration of admission, it will also guide you if this diagnosis was in the best interest or misdiagnosis. For example, if the patient admitted today and we aspirated today and we suspected clinically and after multidisciplinary team and all clinical data going with gouty arthritis. Tomorrow we inject the knee. The aspirate result maybe after tomorrow released and it showed the cell count. However, it's not taking long. The cell count, especially the cell count, it appeared on time. But the result came late and you injected the steroid in the best interest before the result appeared. So this is not medical error as in this
Yes,
scenario.
yes,
But
yes.
if the result appear and you give steroid and you ignore the result, this time will be medical error and you have to apologize. Is it clear now?
Very clear, yeah.
So yeah, this scenario came, I hear them, and I think Riyadh Center, Irish, uh, Irish exam, and it was, I think it was more explained that it was given after the result of the aspirate. So they requested to be apologized for the scenario, and the candidate who didn't apologize, they minus him. But I put the scenario today as uncertainty. I drive the scenario as uncertainty to know how to deal with angry person with uncertainty diagnosis. But if angry person with medical error, it's clear you will apologize and you will deal with the scenario as medical error from the start. But our scenario here is different. Angry person, but uncertainty diagnosis. It's not commonly seen in the exam, right?
Yes.
But you
So,
did it,
Bassem, how to know
yes.
the uncertainty, like from the hint? Is there a hint, quick hint to me, like
You
from
know
the
when
scenario?
how, yeah, from the scenario itself while discussing with the patient, you will know because here also it's not clear when the result appears. Maybe the daughter will tell you in the scenario the result was 2 days ago and they injected the steroid today, so it will be clear as mistake, an error. But
Okay.
in this scenario, yes, you can sense from the patient words it's uncertainty because the diagnosis was given for the best interest for his condition, right? Then the result came as the result in the scenario, more than 100,000. So the diagnosis changed, as you did. You said, yeah, we changed the diagnosis now, and the decision now changed to be managed as admission and antibiotics through his blood channel. Don't say IV antibiotics, okay? It's jargon. This is for, and don't tell me if you have any doubt about that mission, you can complain. Why? I didn't say that.
Mm, mm, mm.
Okay, I'm
Yeah.
angry because yeah, you didn't you give the steroid, but I don't know about the results. But when I know when you told me the result going with septic arthritis, I accept the diagnosis and I accept that it wasn't an error, so it was uncertainty and the diagnosis was bending
Mm.
based on the cell count. I hope it's clear for you
Yeah.
now.
Very clear. Thank you. Nice scenario. Yes.
Yes, and by the way, you're much better than before. I think you are
Thank you so much. Thank you so much.
training in the
Thank you
period, the
so much.
past periods.
Appreciate.
Yeah, yeah. Thank you, Dr. Abdullah.
Appreciate it. Thank you, Dr. Bassem.
Thank you all. Any question from your side, Dr. Abdullah? You want to ask any question?
No, thank you. No, I don't think so.
Yeah. By the way, the medical error will be written in the task as medical error. They are writing in the
Okay.
scenario. Yeah, medical error,
Okay.
so medical error. If not mentioned, you can also feel the words the patient or relative if there is delay or negligence. That time you will apologize. But if nothing, deal with the scenario as uncertainty. Still, we are working, we are
Mm.
taking care of your father, we are following him, monitoring him, we are dealing with him and giving everything, every support we can give to him in the best interest for his condition. Try to be diplomatic and don't put yourself in trouble if don't mention something you might be in trouble if you mention.
Yes.
Okay. Okay. Any other questions?
No, thank you. Thank you so much.
Okay, most welcome. Alaikum assalam.
Dr. Basim, if you patient came to the ER with different this gout
You, you have some internet problem, Dr. Abdul Majid? No, it's not clear. Your sound is not clear. Change the mic. Change the mic, please, or you can talk through the speaker.
Dr. Basim, السلام عليكم.
Alaikum assalam wa rahmatullahi wa barakatuh.
كده واضح يا باسم؟
Still, والله, there is echo. You have some connection problem. Okay, if you can't, you can send the question written or rejoin back. Okay.
Hello, Dr. Basim, السلام عليكم.
Yes. Now clear. Walaikum
Yes.
assalam.
If this patient came to us in the ER and we suspected this patient he has
If
gout
what?
arthritis and give as we diagnose he has gout arthritis and give him medication and
Yes.
discharge, not for treatment, not for admission. And
Uh-huh.
patient came back with feature
Okay.
of sepsis. Due to this patient already he has septic arthritis and developed sepsis and came again to ER with septic arthritis. We can suspect this patient here he has medical error because discharge his patient without
Yes, without final diagnosis.
without final diagnosis. He is a medical error.
Yes, exactly. Medical error.
Yes. طيب
If we
now
did, let me
أيوة.
clarify this issue first. If we did aspirate and you suspect septic arthritis, what you should do?
We need to admit this patient and start antibiotic immediately if we diagnose.
No, before even the gouty and you suspect gouty and you did aspirate, okay?
Yes.
How you can discharge him without waiting for for example, the result of aspirate, final result, either culture or count. This is what I mean. Or you didn't do the aspirate. This is another issue.
We did not do aspirate. Discard the patient as he has a risk factor due to has a real CKD patient and he has it maybe has gout arthritis and give him medication. Already he has on medication or increase the dose or something like that. We are suspecting
Okay.
this patient has gout arthritis without put in mind that his patient he has septic arthritis and came back with
Okay.
sepsis.
Yeah. So what do you think?
We think this is a medical error from us.
Why? It's the gouty arthritis might be complicated with septic arthritis. Any diseased joint can be complicated with septic arthritis, right?
Yes.
So how you
this
can?
medical error because we not did aspiration.
Yes, this is the point.
Yes.
Either to aspirate to be sure this is not septic, because also clinical judgment wise, any patient has swollen joint, you should do aspirate to rule out septic arthritis. This is what we are practicing, right?
Yes.
So before discharging, if you suspect and you are worried about septic arthritis, you have to do aspirate. In this condition, you will be blamed why you discharge him without waiting for the result. And if you didn't do the aspirate, still you will be in trouble. Why you didn't do the aspirate? If you suspect, I mean, you got it.
Yes, I got it. But there is that is medical error. Why not? I think this is medical error because we did not take aspirate from these patients. I take this case as a medical error and go with this medical error and put the scenario as a medical error.
Yes, this is the point. Also, clinical judgment, you have to do aspirate, right?
Yes.
Okay, the second question.
The second question, we now for this patient we start the as the case of the gout arthritis and give the patient treatment, and the patient and the relative ask me why give this patient suspected this gout arthritis and give the treatment? Why not give him antibiotic? You are give the gout arthritis and give blind the treatment without any result of his violations. Why not give this patient? If you ask me like that, why you not give this patient antibiotic as you give him as gout arthritis and give him treatment? Why?
So this is uncertainty still, but clinical judgment and clinical, I mean, how you diagnose him gouty based on the clinical finding, right?
Without this
High
violation,
uric acid
yes,
without aspiration, yes.
we depend on the
Only,
result of uric acid.
yeah, exactly. Not only uric acid, I mean all the finding and
Finding on the
yeah.
risk factor of the patient.
For example, yeah, the risk factor. For example,
Yes,
also the joint. Of course, both joint will be inflamed and swollen. I mean the septic and the gouty. But the septic one, you might have high inflammatory markers, leukocytosis, fever, high-grade
yes,
fever. So in this time, you will suspect septic, right? Rather
yes,
than thinking about gouty.
yes,
So the best investigation to judge the case is to do the aspirate.
yes,
Then you can manage initially as gouty or
yes.
initially as septic based on the clinical finding and the also multidisciplinary team. Don't forget to mention multidisciplinary team opinion and approach because we are not treating the patient as one. We are a team and the medication given in the best interest for his
Yes.
Mr.
condition.
Bassam,
Yes.
Yes,
شكرا دكتور.
shukran.
we can think like the doctor said, when there is features going with septic. Am I right?
Okay,
What if
yeah.
the case is straightforward to gout? Then no need to do aspiration, unless to confirm. This is from the usual yani, practice.
If
I don't know.
what we suspect septic,
No, not septic. There is no general symptoms going with septic, like fever or like this.
okay, if gouty
And
without yes,
yes,
if gouty arthritis without systemic symptoms and inflammatory mark and so on, yes, we can deal as a gouty.
without
But once you suspect,
I mean there is no
yeah,
need to do
but
um aspiration.
aspirate
Yes.
if it's clear for gouty, right? But if
Mm.
you suspect gouty septic arthritis for any reason,
Mm-hmm.
high fever or leukocytosis,
Mm-hmm.
very inflamed joint, disabled joint. I mean the character or the criteria for septic
History of inflammation.
arthritis. Yeah,
أيوة.
it's I agree it's inflammation, but
But
the
not
infection,
inflammation can be
yeah,
septic. Yes.
yeah, the infection will be different in the presentation. Septic arthritis patient, the joint itself might be red like strawberry, and you might have other also manifestation of sepsis, hypotension, leukocytosis. So in this time, you should do aspirate.
Yes.
But if it's clear as gouty and patient has history of recurrent gouty and previous history on gouty and he's on allopurinol, for example, so you can manage as gouty. But once you suspect they are septic, you have to do the workup of septic.
Yes. Because even in the past medicine, there is
Mhm.
investigation you can do for gout, even by aspiration. But I think there is no need if the case is clear, because this is invasive. Am I right? Or shall we mention it
No,
also
no.
in clinical judgment?
You said it, Dr. Awatif. You said
Mm.
this once they suspect, they are doing it. They are
Yes.
following this. Yeah, they are doing. We are sometimes lightly thinking about the patient. Don't be invasive with him. But the correct mood or the correct way to diagnose is to do aspirate.
Yes. Yes.
It's the same matter of you suspect PE. Okay, when you suspect PE, what you do?
We'll give the patient immediate treatment and wait for CTBA or something like that.
Excellent,
Yes. No, I got it.
excellent.
Mm.
Yeah.
Yes.
So you can't just say I suspect PE. I will start anticoagulant, but I will not do CTPA. You
Mm.
will
Yes.
start anticoagulant on time immediately. Then you have to do CTPA.
Yes.
Once you open the door, you have to close it. Okay?
Yes.
Either
Yes.
positive or negative. It's the same issue.
Thank
But
you.
that's a result, Dr. Basim. نحن طالما صدقت septic arthritis, why or not give this patient antibiotic? Even this before after to take aspiration. We suspect it. Why not?
No. If
So
you
that
suspect, you have to. You have to. If you suspect septic, you have to give antibiotics, not to give a steroid. I
ايوه
didn't say
انا
give a steroid.
يس معناتها نحن البيشن لو suspected انه هو septic or gout not differentiate we take aspiration for this patient. As the دكتورة عواطف said that
Yes.
not all the patient we do not take aspiration from the patient if you going with gout arthritis. If we suspect septic arthritis, we will aspirate. So this patient is we suspected. So why
So you will
take
start.
aspiration?
So you will start, and you will do all septic screening workup, blood and blood culture, aspirate also for culture. The same issue for septic shock. What you will do with septic shock? You will immediately withdraw the blood for culture and start broad spectrum antibiotics. Here is the
ايوه
same.
ايوه
Yeah.
تمام. بس انا قصدي انه الريلاتيف لو سالني انت طالما suspected why not give this patient antibiotic طالما
Okay.
شفت
The
aspiration
relative. If I
ايوه
suspected, no, but you said I suspected gouty. You didn't say you suspected septic. If you suspect septic, you have to start
ايوه
antibiotic. You said no, there is gouty arthritis. Why not to start antibiotic? Why I will start antibiotic if I am suspecting gouty?
جاوتي ايوه صح يعني ممكن انه تمام نحن
Yeah,
aspiration
you
regarding
ask
the
a
gout
question.
arthritis not for septic we not suspected
Yes,
septic arthritis
yes. You ask the opposite question. I suspect
تمام
gouty, and the patient relative ask why you didn't start antibiotic. Because I'm not starting antibiotics unless there is signs of infection.
yes and so we do did this aspiration regarding to confirm that is a gout arthritis not for
Yes,
suspecting septic arthritis
yes.
تمام شكرا دكتور باسم بارك الله فيك
شكرا وإياكم يا رب.
شكرا جزاك الله خير
آمين. Okay, thank you all. Any question? Another question? Can we prescribe steroid for gouty before the result? Based on your suspicious and what's your the finding and the signs symptoms going with more. You got it? But the best way is to wait for the result. And by the way, the cell count will not take long. The same, it's like the CSF. Whenever you send for CSF, the count may be the first result to appear. The same idea here. Whenever you send any cells or any fluid for analysis and you requested cells, the cell count will appear first before the culture, before chemistry, because it's the same idea of centrifugation of the blood. The cell, how many cell in this fluid? It's not taking long. So you can wait and don't start unless you have the final result. This is the idea in the scenario also. Maybe they didn't want to inject twice, I mean for the fluid analysis and then inject steroid. No, I don't think so. The aspirate is different than injection. So you mean in the same injection, how to aspirate then to give? No, they can inject again. Why not? Maybe they didn't want to inject.
If I can comment,
So sure.
this scenario appeared recently, I think, in the Irish exam,
Yes.
and the candidate who did scenario as medical error, they get the full mark, and who they did mention any medical error, and they are telling we are suspecting gouty arthritis, and after that proceeding for patient deteriorate and take aspiration to confirm septic. The examiner ask if it is medical error, what you will do. Then if the candidate mentioned that we will admit the error, we apologize and everything, they get also the full mark. So the mentor who discussed the scenario is telling it is medical error.
Okay.
Yeah. So no, to confirm gouty arthritis, we need to aspirate first. The error here
Yes,
that they are
that
giving
they
steroid.
give an steroid, yeah,
Yeah,
before
giving
the result.
steroid. Yes. If they are giving non-steroidal or anything, it's okay, but they are giving steroid without confirmation of
The
gouty
injection
arthritis.
itself,
This is
yeah,
error.
need to be, yeah,
Yes.
this is what we discussed, but yeah, I agree in this point. But let's say that the scenario details may be different, maybe the timing of the giving, I don't know, but what I got from this scenario, it can be
Yes.
drive either medical error if you inject without waiting for the result. This clear error. But if
Yes,
you
this error. Yeah.
suspect,
But written in
yeah,
scenarios that they are assuming gouty arthritis. They are assuming. So they are
yeah,
differential of gouty versus
if assuming and they give steroid as best interest without waiting for the result, this is also an error.
this error. Yes.
Yeah,
They are
yeah.
telling no in the medicine, no need to tell. We are assuming. We have to confirm, then to start according to your test.
So the result came on time. This one will be as error. But if the result, for example, take time and they give the steroid for the suspicious, it can be, from my opinion, I mean, it can be like, but still, no excuse to wait for the result. I agree with this point also, yes. He
Yes.
should wait for the result.
I think the
Clinical,
scenario
as
is not.
clinical judgment, yes,
Yes.
yes,
Yeah. That's why maybe the examiner he gives the boss the full mark who did as medical error from start and who not
yes,
mentioned
yes.
scenario not obvious actually.
Yeah, that's why I'm telling you no clear details. Maybe there's hidden details or no missed details. We are not,
Yes.
yeah, we didn't pick up it because the
Yes.
scenario when it will be transferred from person to person, some points will be missed.
Yes.
I think let's uh, let's take the home message from this scenario. Whenever you have suspect septic arthritis or gouty arthritis and you did the aspirate, don't inject, don't manage, don't judge unless you have the result. And the result will not take long. Okay, is it clear now? Especially the intraarticular injection.
Thank you.
So that any
Okay,
medication before expiration result, it is a medical error regarding gouty arthritis
yeah,
or septic arthritis.
yes, yeah. So the result will appear soon. It's not taking long.
Yes, yes, yes. I think that. Yes,
Okay,
thank you.
yeah. Dr. Aisha comment you so you can aspirate without suspicion of septic, just to diagnose and to relieve the pain. You can aspirate without suspicion of septic. Yeah, it's not only to diagnose septic. We know that we can't diagnose gouty or even the pseudogout by aspiration, right? The needle shape or the rhomboid shape to diagnose either gout or pseudogout, not only for the septic. So, okay, I agree we should wait for the, yes. Let's see, this is the take-home message for today's scenario. If you suspect gouty or septic or whatever, and you want to manage, wait for, and you aspirated already, wait for the result. And according to
Wait
the
the
result,
result or aspirate
yeah,
and then give antibiotic. Wait the result, aspirate and
but
then give an empirically صح؟
this is for
Not
the
wait.
septic. If you suspect septic more,
Yes.
okay, the septic is different because if you delay the antibiotics, I'm just I didn't mention the antibiotics. If you suspect septic, you have to give after the aspirate. The scenario now about gouty, so don't inject unless you have the result because you might flare up the septic arthritis.
Oh.
Clear now? I'm talking about particularly about the case today. Don't inject steroid unless you have the final aspirate result. But if you suspect septic arthritis, on the other hand, you will immediately after giving the aspirate, after aspirating the joint, you will give the antibiotic. Clear?
Yeah.
Okay. Sorry, I know the scenario is confusing for all, even for me. I was also confused earlier about the between the query gouty and septic, and even the scenario itself as a medical error. So once you have a result and you give a steroid, this is a medical error. But so don't give unless you have the result, especially for gouty arthritis. But in the other hand, if you suspect septic, you can even give the medication after the aspirate, because the septic management will be, if you delay the antibiotics, the sepsis and the sequelae of septic shock will be worsened more and more if you didn't start antibiotic earlier. Is that clear now for all? Where are you, Dr. Aisha? You didn't
Yes,
comment
it is
today.
clear, Dr. Bassem.
Yes, Dr. Awad. Thank you also for clarifying. Yeah, sometimes the scenario from the first time is not clear. But if some candidate have or has background from other friend or colleague who underwent the exam, please clarify it more and more with us, okay? Yeah, thank you all. Thank
Okay,
you.
thank you.
Yeah,
شكرا
thank you,
جزيلا.
Dr. Awad.
بارك الله فيك
Thank
شكرا
you
جزيلا
all. Thank
بارك
you
الله
all. See you tomorrow,
بارك الله
inshallah. Long clinical consultation. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.